kids total, right? When I was working there, I really wanted to work with students and figure out kids who weren't going to college for whatever reason, right? There's so many reasons why individuals might not be able to go to college or might not go. But we had a large percentage, like 30% of our graduates were going into the workforce. And we did a study when I was first on school board to look at where are they going, right? What type of jobs are they getting? And I was really concerned to make sure that individuals knew that there were possibilities for family sustaining wage, whether you went to college or community college or whatever it might be. And what we found out is that our students were mostly going into retail jobs. So they were going to jobs that didn't really have a upward mobility or a trajectory, right? They weren't family sustaining wages. They were mostly minimum wage or under $10 an hour. And so I worked with our school district administration to figure out where are we going wrong? How are we not educating our kids and our families to know what possibilities are out there that if they can't go to college for whatever reason, what are their other options? And so we created this program with like the building trades and the technology companies and bringing all that information into our high school and to make sure that we were training our administration and our counselors and all those pieces. And then I started to think, well, there's 16 school districts in Delaware County. And this is only one school district. And if what's happening, because I was using resources from Montgomery County and Chester County and Philadelphia, and I was like, what is happening in Delaware County? Why don't we have these programs? Why aren't we already doing this? Why aren't we doing it for all 16 school districts? Right? I was very happy that we were able to do a program like that in Upper Darby because that's where I live, that's where I'm from. But I wondered why we couldn't help others. And when I looked into it more, I realized that Delaware County's workforce development, we're supposed to have a workforce development board, just was kind of non-existent and wasn't really doing their job like other counties were doing. And that made me look into Delaware County government more. It kind of opened my eyes to be like, well, what else aren't we doing in Delaware County? And then I realized that we were the largest county in the country by population that did not have a health department. This is before the pandemic. We have 575,000 people in Delaware County, and we didn't have a health department. We didn't have anyone looking out for public health reasons, didn't have anyone monitoring, all those pieces that were very, very important before a pandemic. Right? And that's actually what made me want to run for office. We also had the only private run prison in the Commonwealth. So when you think about a private run prison, and for me, looking at the statistics around who is in that prison, it was a high number of folks that look like you and I. And when you have a model of a prison where they make a profit, the more people they have in the beds. For me, that was an issue, right? That's a moral issue. Why are we doing that? Why are we the only for-profit prison in the entire state of Pennsylvania? And why are we trying to fill it with people, right? Shouldn't we be trying to figure out programs that make sure that folks aren't going to prison? Where are we doing the prevention? Where then it comes into school board with the school to prison pipeline, right? It's like, how are we preventing that? But if you have a system where at the end somebody's making money, the more people we go in, that's a problem. And so those were the two big reasons why I ran for office, or really three: workforce development, health department, creating a health department, and trying to deprivatize the prison. So bringing that prison back into county control. And so I've been in office now. This is my 5th year. I actually ran for office. And when I ran for office, it was a really difficult race because in Delaware County, there had never been a person of color elected, male or female, across the county. And there hadn't been Democrats in control of Delaware County. So it had not been a Democratic controlled county since before the Civil War. So when I ran in 2019, there was a lot of folks that were like, all right, you guys aren't going to win. Democrats never win in Delaware County. You're not going to be able to do this. And so we had an uphill battle. What we did was we went out and talked to people a lot, right? That's what politics is about. It's about trying to make sure you get your message out and interact with folks. And so we went out, knocked a lot of doors, went to every single community in Delaware County. How How many of you are from Delaware County? Okay. All right. I got a couple of you in here. Or Chester County? Philadelphia? Okay. All right. Montco. All right. All right. So we got a little southeast contingency. And so it's really about getting out there, right? We have 49 municipalities or towns and boroughs in Delaware County. So my goal is to get to every single one and talk to people in everyone and talk about what I wanted to do. And no matter who we were talking to, when we talked about the fact that we didn't have a health department or that we had a privatized prison or that we didn't have workforce development, one of the big pieces about workforce development, once I got into county council, I found out that we were actually giving money back. So remember when I said they weren't doing their job? We get federal dollars to help educate people, to help train people, to do things like you're doing here, right? And they were sending back over $1 million a year because they weren't doing programs that they were supposed to be doing. And so that's why I didn't see them. That's why I was like, oh yeah, I'm using Philly, using Montgomery County, because we weren't actually doing our job. And so we were able to win the election. We actually won. It was clean. It was a sweep, right? We won every single seat in 2019. And so I was sworn into office for the first time in January of 2020. That same week, so I was sworn in on a Tuesday. I went down to Harrisburg on a Friday. I had a meeting already set up with the state health department, right, to talk about what is the process to create a health department. Mind you, COVID didn't hit, didn't close everything down until March of 2020, right? So we're trying to start building a health department at that point. Did the work, really started the groundwork. In Pennsylvania, there had not been a health department created since 1989, and that was Montgomery County. And so when we were working with the state, they were like, nobody's here. That was back here. That was here then, and this is the antiquated law that you have to go by, and these are all the steps. So we put those steps into play. I pulled in as many people as possible. What I feel like government should be very representative of the people that we serve, and that we should also get voices from everyone we're talking to. And so I try to bring in as many people as possible on every topic. And so for this, it was like, who would like to help? Who would like to put in their input? All of our hospitals, our universities, who can help us get this going and make this happen? Who are the people that we're serving with the health department? You can't serve individuals in the community if you don't actually have their voice at the table. Because you can be thinking about all these things that you think are the right way, but if you don't actually have people who are being served, then you're missing the mark. Right? And so having all those folks together, that's actually what helped us, because we were able to, now they told us the process was going to take about 2 years. We were able to do that and keep it going through the pandemic and through everything and keep that process rolling. We just moved our meetings to virtual. Everybody had their marching orders, everybody did their thing, and we were able to keep it going. And when the pandemic happened, thank you to Chester County, because they actually agreed to be our health department. We paid them to come in and help us and be our health department during the pandemic. And then we were able to successfully create a health department, a county health department, for the first time in over almost 30 years, over 30 years. And so we were able to do that. So we created that. That was within the first 2 years. We also deprivatized the prison. So at the same time, we were working through the process of getting rid of that contract that someone was paying, that we were paying, that all of our tax dollars were paying for someone to run that private prison, and bringing that back into county control. And so in April, actually, they're both about to have their 2-year anniversary. In April, we were able to have deprivatized the prison and also create a health department. How many of you in here know what does county government do? Do I have any guess? What did you say? Governing the county, yeah, yes. But what does that include? What do we think, right? We have all these different levels of government, right? We have your local municipal government. We have our federal government, right? We see them all the time on TV, right? We have our state government. We have our Josh Shapiro, our governor, and our state legislature. So what does the county government do? Okay, that's a good thought. That's a good guess, right? But schools actually are their own governing bodies, because In Pennsylvania, so it's different in every state. In Pennsylvania, we're Commonwealth. So what that really means is that there's a lot of local control. So it goes all the way down to the school board level of where they have their own school board. That's who picks and chooses what type of curriculum goes into the district, what type of activities they have, how many school buildings, who goes to each school building. All that falls on the school board. We also have our municipal government, right? Funding for the school districts. Some of it comes through us, but it's more by way of services, like mental health services or supports that are in the buildings. The funding for the school districts, which is a whole nother problem here in Pennsylvania, is done through our state legislature. How many of you have heard of the lawsuit that some of the school districts have filed against the state in the way that they fund education? All right. So there is a lawsuit that the school districts won because we have an inequitable school funding system, right? Some of you may have heard that, right? That we're not funding our schools properly. So out of 50 states, we are 48 out of 50 on how we fund education, and not in a good way, right? So most states pay about 50% of the state of the how much the budget is for school district, right? Here in Pennsylvania, we're at somewhere around like 30%, 25, 27, 30%. Okay? So we're really low. And so that means each school district has to depend on the local property taxes. So either the businesses or the individuals who live in that school district to pay for the school district. So it makes for a really inequitable system, right? Because if you live somewhere that is higher socioeconomic status, all these pieces are somewhere that has a lot of businesses, right? Like King of Prussia, that school district has a lot of money because they have a massive business, right? That funds the schools, right, through their taxes. Other places do not. And so when you look at Delaware County on its own, right, this is just in the same as public schools, right? We have 16 school districts. Radnor School District is up in the northern part of Delaware County. They are spending about $27,000 per pupil. It's a public school. Our lowest funded school district is William Penn School District, that like covers Dayton, Darby, parts of southern Delaware County, and it's funding at about $8,000 per pupil. And that's just the difference in our small county in Delaware County, right? So when you think about the school district band together and sued the state for not funding equitably. Okay. That took me on a tangent, but going back to what do we think our county government does?
I believe the county government is like the bridge between state government and city government. So the same way that the state government is kind of the bridge between the county and the federal government. That same way.
Great. Yes. Right. So we are almost like a pass-through for the state, right? So we get dollars and funding. Our operational budget is about $300 million, and our fiscal budget is about another $350 million. So we have about a $650 million budget, right? The fiscal part is all of the money that comes down from the state and federal government for us to provide services. So all of the mental health services, all of the public health services, our veteran services, our housing services, those are all done through the county. So a lot of the services that folks get or interact with, those are done through the county level of government, right? When you get to your municipality, like I live in Upper Darby, their role is to do some business stuff for the local community, but it's really doing the trash and the garbage, but the streets and those really, really local issues, right? That's what a township is for. The county's role is to help provide services for everyone who lives in the county, right? No matter which municipality they live in, right? And so we also have our county prison and our county workforce development, right? We have offices all around the county that provide different services. Our senior services, those are all part of the county government. So now I've been in office for 5 years. I just ran again last year. Was reelected. Our priorities the first 4 years was really to get through the pandemic without a health department, create a health department, and deprivatize a prison. And we were successful in doing that. That was what we ran on. That's what we said we were going to do. New priorities for going forward are, for me, it's really continuing to hone in on social services, right? Creating more access to mental health supports, better housing opportunities, right? You all are all going to be out at some point in time, right? You're all between juniors and seniors. And so you're going to be out there trying to figure out where you're living, what type of rental house or purchasing your first home. My goal is really to try to figure out how to make housing more accessible for everyone in Delaware County. And so making sure that we don't have the crazy uptick in rent, right? Since the pandemic, housing and housing affordability has gone crazy, right? People who used to rent that same apartment is like $500 more in Delaware County per month, right? Housing stock has gone up an excessive amount. And so trying to figure out how we as a county government work with our local municipalities and work with our residents to make sure that housing affordability is a part of what we do, right? And that it is actually a thing in Delaware County. Also focusing on maternal child health. So for those of you, there aren't that many of you that are in Delaware County, but we have a healthcare system. Chester Crozier is our healthcare system, or Prospect Crozier. And so they closed down 2 hospitals in the last 2 years. They have 4 hospitals, so they're our largest healthcare system in the county. And so we're very concerned with making sure we have actual access to healthcare in Delaware County. Right now, the only hospital that was in Upper Darby is one that closed down. Right? Those individuals now have to go to Mercy Fit, they have to go to Philadelphia for healthcare services, or they have to go to Chester for healthcare services, right? And we also no longer have maternity support because that was what was in the eastern side of Delaware County. And so now the closest place to deliver a baby is in Philly and Lincoln, or down in the city of Chester. Right? And so that is a big concern for us as a county council, because that means we don't have accessible healthcare. And that means people who aren't able to get to a hospital that's 25, 30 minutes away, they're going to be put in a situation where they're at risk, right? They're not able to get regular checkups, and all of the trickle down effect of what that causes and how that impacts the community. Right? And so those are some of our big priorities for this year. Any questions? So that was a lot, right? That was a lot of information. County government actually does a lot of work. And it's kind of unseen work, because it's more like if it's not there, then you notice it, but we're just kind of doing the job every day of the county government. But we do have to work with I always talk about a ladder of government, right? We have our municipal government, we have our school boards, we have county, we have the state, then we have the federal government. We need all of them to work in order for us to provide the services that we provide to our residents, right? We're all serving the same residents. So our congresswoman helps make sure that we get funding from the federal government to pay for our workforce development programs, or to help support our school districts. Right? Our state legislature, right, which is the state Senate and the state House, they work to implement policies in our state and to get funding, and to make sure that we get funding to be able to do the programs that we do. Right? And so when they're at odds, or when they're not functioning, or when they're not passing a budget, that has a trickle-down effect on us, right? Because if they don't pass a budget, then that means we don't have the funding that we thought we were going to have in order to run a mental health program, or in order to help our seniors, or have a senior center, or all of those pieces or aspects of our county government. So it's really important that all of the pieces and all of the ladder of government work. And so we actually have regular communications with our state legislature and our congresswoman's office, and try to make sure they're aware of projects that we're doing, or projects that we are starting to do or thinking about doing. So when we were doing the health department, I had a monthly update with all of our legislators to say, hey, this is coming down. We're going to need funding. The state is we're going to need approval from the state. We need you to help us with this. We're going to need this amount to be put in the state budget. And they were all on board. They were all helping. So because they knew about it, right, they were able to help move it along and make sure that once we were ready to open, we had all the support and everything lined up to be able to make that happen, right? If we would have just gone along and done our own thing, it wouldn't have really worked. It wouldn't have worked, right? Because we would have done it, we would have been ready to go, and then we would have started the process of talking to them or trying to figure out how the funding was going to happen and all those pieces. You kind of have to think about it and make sure that you keep people in the loop and at the table. Are there any of you who are actually or political science majors? Anyone? Anyone interested in going into service, into politics? What majors do we have in here? Psych, business, accounting, finance. All right. So all of those majors, we have jobs at the county level. Right? So sometimes we think about one thing, but remember all of the aspects in which the county government covers. Right? We have our treasurer's office, we have our controller's office, finance and accounting folks. We have a large PR and comms teams. I thought I heard comms. Of course, psych, right? We need more of you, please, please, please. Bring more folks into psychology and sociology because we need you, right? All of those different, we have 3,400 employees in the county government, 40 different departments. Those of you who are like urban planning or civics or whatever it might be, right? Those type of jobs also exist. Engineering, we have engineers. We have our public works. We have to design and help to figure out how we're going to go about the landscape of our county parks and buildings. So there's a lot. All right. Any questions?
So you mentioned that. Well, you just mentioned that you have 3,400 employees, 40 departments. As president of the county, how do you manage that type of work in addition to like the $600 million how do you like balance all of these things?
Yeah, it takes a lot of time, and I would say so. Our position counts as part time. It's considered a part time position, even though we spend quite a lot of time in the. And so I do have a full time job. I'm a full time professor and a graduate program director at Temple. And the county government, I do believe in a few years it might not be as in depth and as that we have to spend so much time at the work because we have to build out our team, right? When we came on board, because of the shift in policy and the shift in ideology, right? We were moving from having been Republican run to democratically run. It was the first time since the Civil War, right? So when we won in November, we had over 300 people quit between November and January of our swearing in, right? They just quit because they didn't know what was going to happen. They didn't know what was going on. They thought we were going to come in and fire them anyway, whatever it might be, right? That's how many people have quit. A large portion of them were actually our directors of those 40 plus departments. So when we came in, we didn't have directors. We had a large hole in terms of people who were working in the county government. And we also didn't have the infrastructure to set up. Our government was, we didn't have the infrastructure to set up to be able to recruit people. When we came in, we didn't have a full HR department. And so we weren't even putting like jobs online. It was all like word of mouth. We didn't even post jobs. We didn't even have the mechanisms to do so. So then the pandemic hit. And so we had to really kind of build it from the ground up. It was like we were a startup while we were at an actual county government. And so that's a long way of getting to your question because it's more of setting the stage of what we're doing right now. And now we've built the team, right? We brought in, I think, 35 new directors over the time since we've been there. We have a brand new executive director who's amazing, right? She used to be the deputy executive director of Montgomery County. We've been working in county government for over 3 decades. And so we have a deputy executive director now. That was the position that was there before. We built a sustainability director. We have a DEI office that we didn't have before. Like all of these pieces of the puzzle, we had to build from the ground up. And so now we have the infrastructure and we have the people, which is the most important thing, the people who work in the county, that allow us to do all the things that we do and to implement all the programs. Good question.
I was going to ask, was there any moment while you were trying to rebuild and start like the health department, were there any moments where you felt like there was either a barrier or you kind of were like, you felt like it was a little hopeless at some points because you're pushing and pushing and pushing and there might be like some people that are not on the same page as you? Or did you ever feel like, yes, this is taking long, but I'm gonna do it and like no matter what?
Yes. Yes. I felt like that often, right? Because there was just so much going on. It's not that we were just building a health department. That's hard enough in itself, right? We were trying to build a health department while also responding to a pandemic for 575,000 people without having a health department, and trying to do all these pieces at once, and also trying to create a brand new culture, right? We were trying to turn it upside down, right? And really redesign what county government should be, and to try and change the thought process of people who have been in the county government for a long time, because we are really about accessible government. It's like we need to be out there where people are, and we need to help people where they are, meet them where they are, versus, oh, we have this old style mentality of you have to come to us to get the services that you need. So yeah, there was a lot of pushback. And I think the fact that we were able to create that group, that working group for the health department, really helped, because while we created that before the pandemic hit, they were a voice from so many different sectors and areas. The foundation of Delaware County, our universities, all of our hospitals, community members, right? All of these pieces. And they were also as invested as we were in trying to move it forward. So they just kept going. Even though they were all busy with the pandemic as well in their own respective areas, they helped to also keep it going. And so I think having that really core group was really important, because I don't know what we would have done if we didn't have them and didn't have them on board before the pandemic even hit, right? And so that was a big piece of it. But yeah, hit barriers. Thought this is probably never going to happen. I don't know how we're actually going to get to the point of having an actual health department to, oh my goodness, we built this. we did it, and it's happening. And it was really amazing to be a part of it, but also to see that everybody felt like they were heard in the process of making it, right? We did all of these listening sessions. We did them virtually because it was in the height of the pandemic. Every single group, we met with all the NAACP, we met with all of the municipalities individually, we met with the birthing group, we met with like any group who said, yes, we would love to talk about what we think the health department needs. We met with them. So we had over, I think, 52 roundtable discussions with various groups from all around the county. And I feel like everybody, once it was done, everybody like was like, yes, because they felt like they were a part of it. They helped us do it. They helped us move forward. And so that really got buy-in over time, because it was like, oh, we had the police chiefs in, we had the fire chiefs in, like, it was like, who wants to talk about this? Tell us what we need, right? And that's really our style, right? That's how we, because, right, if you don't have people in at the table, then, we might not be meeting their needs, or we don't even know what their needs are. Good question. Any other questions?
I have one question. Normally at these presentations, the presenters talk about what you can do for us, but there's some things we can do for you too, perhaps. For example, we do quantitative research, meaning we do customer satisfaction surveys. And I'm certain county needs to understand the trends and attitudes of the constituents within the county.
Yes.
And we could certainly, at least in political science,
Oh, yeah.
perhaps sociology also, but in other fields, we'd be willing to work with you. I'm sure Lincoln would be willing to work with you, just doing public policy stuff.
Oh, we would love that. Yeah. Because the more we can have a beat on what people are thinking, what the big issues are, and how they're feeling about our services, the better it is, the better we can actually do our job.
And also we can employ some of the students
Oh,
to
we love
take the
that.
surveys,
Yes.
increase the community's awareness of the institution.
Yep.
And what we're actually doing.
Yeah, that'd be great. We'd love to get your card and follow up with you on that.
I just have one more question. It was a double-decker comment. So you mentioned, I believe there's 49 municipalities in the county.
Yes.
How expensive is that area in terms of how much does the entire county spend?
Yeah, so we are, let's see, I should know exactly how far it is. But it's probably about 20 or so square miles. So we're actually the most condensed Collier County. So we're really small, but we have a lot of people, right? So we don't have a lot of rural area. We have maybe the small, like western side of our county, like right by Westchester. That's like Thornberry, and that's where we might find some farms. But for the most part, we're condensed. 575,000 people, and we're like half the size of Chester County in terms of actual space.
Right. So I wanted to ask you, with the about 6,000 people that you serve in a 20 square miles, what are the like limiting factors in terms of having a hospital for such a condensed county? Is it like something that the health department has to do, or you guys as a county, or is it like state things that are above you guys that you necessarily don't have to handle that are preventing you from having a hospital? Because I was just listening to the part you were saying about like maternity and things of that nature. People having access to healthcare in a county that's, like you said, 20 square miles. That's pretty reasonable amount of space to have one hospital at least. So I just wanted to know like what were some limiting factors and maybe what are you working on currently to ensure that happens?
Yeah, so that's a good question. So for us, the biggest factor with our hospital system, and this is, I'll say it's my personal belief, is that Prospect Crocher is a private hospital, and I don't believe healthcare should be privatized. I don't believe that a hospital should be privatized because they have different motives, right? A nonprofit hospital is there to serve the community. They're there to meet the community's needs. A for-profit hospital is there to make a profit, right? And so when they're not making that bottom line and their shareholders aren't happy with it, then they can close the hospital and we can't do anything about it because it's a private company, right? And so we have to bring in, which we have done, bring in supports from our state and our federal government to try to help stabilize that system, but also to try to help build it up and think about what are our alternatives. How do we get a nonprofit hospital to come in? And that's where we're at right now. They've put it up for sale, and it's a public sale process. And so we've made it. The Attorney General and the Governor's Office have worked with us to make it so they can only bring in a nonprofit to take over, and really trying to work with all of our nonprofit partners in the region. Right, we have a lot of hospitals that are really good hospitals in the region, and and they see it and they understand what that impact will have on the community, what it'll also have on them. Right, our hospital systems in general have had a hard time coming out of COVID. And so that impact is a trickle down, right? If we don't have a hospital, then everybody has to disperse and go somewhere else that fills up ERs elsewhere. And then those are only the people that can actually get the help. Right? I'm highly concerned about the people who can't get the help, right? They don't have the means to do so. And that should not be how our healthcare system is based. Good question. Any other questions? Yes.
So Lincoln University is a state-related institution, and as such, we're very dependent on the state. As I heard you talking about all the things that you were able to accomplish, how much does budget and your dependence on things like the state and others really affect what you do, and what aren't you able to do because of that? Because you did a lot, but you also are dependent on money that comes from the state, federal government.
Yes. No, it's a good point. We are highly dependent on state and federal funds for our services. And so when you think about, especially I talked about one of our goals is to expand mental health services, right? Expanding mental health services in our county would also be very helpful. Hello, Solar. Would also be very helpful if our state government actually improve the mental health funding, right? And expanded upon that and added more dollars into that budget, then we could provide more services. But when you look at our services now, we have people who have a long waiting list, or you have kids who are flagged by a school district that they need support, they need help, and it might take them 6 months before they actually get an appointment or a meeting, right? And that's a problem with funding because we can't fund more programs, but it's also an issue with our workforce development, right? And all of that plays in. We are very, very dependent on the state, and they're very dependent on us to provide the services. So not having funding makes it so that we can't provide all the services that we need. Good question. Any other questions? All right. Well, it was a pleasure to speak with you all today. Thank you for having me. Great questions.